Greetings, everyone. We're waiting for a few more people to arrive, and we'll start at the top of the hour. And welcome, everyone. I'd like to say hello from the National Physical Activity Society. I am Pam Idson, Executive Director of the NPAS, and I'm pleased to welcome you today to a webinar titled The Lifelong Mental Health Benefits of Physical Activity. We have a full webinar today. We may actually have a few people who are unable to get on, and so I'd like to remind those of you who are here that you will receive an email later this afternoon if you're pre-registered. And on the email, it will have a link to the webinar. It will also be posted on the NPAS website, which is physicalactivitysociety.org later today. Throughout the presentation today, you can submit questions for our presenter by typing into the questions panel. Send questions at any time. I'm going to collect them, and then we will pitch them during the Q&A session after the presentation. We have a continuing education certificate. It's here on the webinar site while you're taking it. It's also on our website. Physical activity and public health specialists can earn 1 credit for today's webinar. And now to introduce our speaker. Dr. Kara English is a doctor of behavioral health and a licensed associate counselor with more than 20 years experience as a mental health provider for children, adolescents, and adults in diverse communities across Arizona. She delivers classes on improving nutrition and increasing physical activity for families, and she supported individuals and families in making difficult behavioral changes that improve overall health. Clinically, she works with prenatal and postpartum mothers and uses physical activity as a treatment strategy to improve mood, release stress, and help patients sleep better. She works as CEO of the Cummings Graduate Institute and the director of its Doctor of Behavioral Health program. She lives in Phoenix. And I'm going to turn it over to Dr. Kara English.
Good morning, everyone. Thank you for having me this morning. I'd like to say thank you to Kathy Dean, a colleague of mine who invited me to be part of this society's webinar this morning. And if you're out there, Kathy, hello. So this morning, I'd like to share with you a little bit about what the research says on a couple of key topics related to benefits of physical activity in terms of mental health. So the key topics for this morning's presentation are going to focus around reviewing the key highlights of the research on a physical activity prescription or treatment method for depression, anxiety, stress, ADHD, and PTSD and trauma. Those are the primary chief complaints that are seen in most primary care as well as specialty mental health practices. And after today's presentation, hopefully we can be knowledgeable or more knowledgeable about how to share research-based and evidence-based guidelines for patients who are suffering from those conditions. The second key topic is how can I, as a human, help others overcome mental health obstacles to physical activity? And we'll talk a little bit about some of the barriers that folks face when they're going through mental health illness and how to address that with specific strategies to help them get started. And then finally, what are tips I can give others for getting started with physical activity when they're anxious or depressed, knowing that we don't all start in a state of motivation, that it takes often a lot more to get someone started or to help them get there, especially when depression or anxiety is part of their condition. So first, let's talk a little bit about the correlates in physical activity in terms of the research. I know there was a question about age and gender, and we're going to specifically talk about that today. So with age, just know that physical activity tends to decline in age in adolescence. So starting at about 14 years of age, particularly in girls, physical activity begins to decline. And then we also see another decline in the level of physical activity in adulthood, from adulthood after about age 24 through to older adulthood. And there are gender differences, especially in the case for older adults. older women tend to report more chronic health problems. And there's also a heavier socialization pattern with the kind and quality of physical activity that tends to create some gender differences. But more specific to gender, when we are born, there is no difference between male and female in terms of the level of activity. But after birth, males begin to become more, or after infancy, males begin to be more active than females. And particularly, males tend to show more vigorous activity than moderate intensity. So with women, we have some specific challenges to overcome when it comes to participating in more moderate to vigorous intensity levels of physical activity. In terms of race and ethnicity, non-Hispanic whites tend to be more active in terms of the research and less sedentary than other groups. And this is again particularly true for women, adolescents, and older adults. So we want to know that those correlates are, important to keep in mind when we're working with different populations, and in our ability to target specific groups for interventions. As far as education and income, the research indicates a positive correlation between socioeconomic status and physical activity in adults. The same is not true, or we did not see that correlate for children. However, we know that socioeconomic status plays an important role in mental health, and that effect is further nuanced by race, ethnicity, and gender. And so in the next category down, you'll see health status and social environment. When you have an adolescent or an adult, regardless of gender, in a poor health status, or additionally in a social environment that does not support access to or emotional interpersonal support, appraisal support, or tangible support, such as a ride to a gym or a park, if it's not a safe neighborhood, we tend to see greater barriers in terms of accessing or being regularly physically active. So these are things that we want to keep in mind when we're talking about specific populations that are more in line for interventions when it comes to physical activity. And then we'll talk a little bit more about mental health and how mental health conditions can impact these correlates. So let's talk a little bit about physical activity and depression. So first of all, in healthy participants, there has been shown in the research an inverse association between physical activity and psychological distress, when the physical activity guideline of 150 minutes per week of moderate intensity or vigorous activity, or 75 minutes of vigorous physical activity was followed. And it doesn't matter whether or not the patient or the person uses a weekend warrior approach to physical activity, meaning just 2 days a week of physical activity. The same or similar benefits were seen in folks who had a level of moderate to vigorous activity every day, or just in the weekend warrior way of participation. So we know that we can use an exercise prescription in terms of treating depression that can be almost as effective as an antidepressant, or as effective, depending on the research study, for treating mild to moderate depression. With more moderate to severe levels of depression, exercise alone will not be enough of a prescription, and a multimodal treatment, typically including psychological or psychoeducational therapy in addition to medication, is primarily going to have to be used. However, we know that we can encourage patients to get active, and that it often will lift mood while they're waiting for medication to kick in. And so I often recommend that my patients begin walking at a minimum of 5 to 10 minutes a day. That usually sounds more doable than asking a patient to get up and do 30 to 60 minutes a day. And they often find that if they can do a 5-minute walk, they want to do more. And so if I can get them out thinking that they're only going to do a 5-minute walk, which seems more realistic and doable, then they often will do more. We can also use physical activity to prevent depression. And we know from the research that for folks who maintain a regular physical activity schedule, it actually prevents relapse in depression for those with a prior history or for those with family history. And so, again, going back to looking at adolescents, if we can prevent those, particularly adolescent girls and into womanhood, from becoming sedentary, we know that we can prevent more mental illness. So this is critically important for us when we look at schools. If we are encouraging females to stay active as they are coming up through school, middle school, high school, and into college, then we have a greater chance of preventing depression, which is a much higher risk for women in general. Women are at 20 to 30% higher risk over males for experiencing anxiety, depression in their lifetime. So knowing that physical activity can be useful for both preventing and treating depression, this is something that we want to all be encouraging in terms of policy and practice. The physiological and neurological impact, which is important to share with patients. A lot of patients are looking for ways to reduce inflammation through eliminating processed foods, gluten, wheat, soy, allergen diets, and we want to let them know that physical activity also reduces inflammation significantly. And while it's reducing inflammation, it also increases dendritic growth. So dendrites are part of the way that our neurons communicate to one another. Think of them like the branches of a tree or the leaves of a tree, reaching out and making connections. So we want to see dendritic, we want to see new dendrites, and we want to see them making more connections. And that's exactly what we see with regular physical activity. Physical activity also improves alpha brain activity, which is the type of brain activity that helps to calm mood and focus. And so you'll hear this a little bit more when we talk about anxiety. And we know that it releases endorphins, which are the feel-good chemicals. And so we know that our patients will feel better once they begin to be physically active and maintain a level of physical activity. We also know that they'll sleep better. We know that they will be able to think more clearly. And we know that their pain will also be reduced. And so these are all impacts that we want to share with folks when they're considering what type of treatment for depression they want to pursue. Physical activity should always be one of the treatment methods that we're talking about with our patients. There has been many studies on the level of encouragement that patients receive in primary care or even in specialty medicine from physicians about physical activity. And we know that at least 65% of patients who have depression or other chronic illnesses are not being encouraged, and there's been no discussion at all of physical activity, which to me is insane. Physical activity and nutrition are two of the first things that I talk about with my patients who are anxious and depressed because I know the science. And so we need to make sure that we're looking at this as part of the whole health picture for our patients. Finally, in terms of psychological and social impact, we know that a patient who is physically active is clearing their mind. They're able to find distraction from negative thought patterns that can otherwise play like broken records in the back of the mind. They get a break from a stressful home or work environment. And if they're connecting with others at a gym or finding a buddy, a workout buddy or a partner, even just one other person to take a walk with once a week or twice a week can be significantly better for a patient who's stressed, who may not have much of a break from stressful events in life. And certainly when we have children, when we have busy lives and it's difficult for us to connect with others, socialization through physical activity can double improve the benefits. We know that when children and adolescents and women and older adults have workout buddies or particularly participate in team sports, they have a social benefit in terms of encouraging them to remain active. And so we want to encourage them to take classes or perhaps join a new workout class or team or coach. There's a lot of growth in Orange Fitness and the types of gyms that have cohorts, and there's a lot of social capital that is gained through group or team sports. And so we want to encourage people who are very social people but don't have much physical activity in their life to think about ways that they can meet both of their social needs as well as physical activity needs through group fitness. So let's talk a little bit about anxiety. We know that physical activity is a natural and effective treatment for anxiety. This is something that almost any physician should be able to tell you off the cuff. Just for, many of the informal things that we quote unquote know, definitely the tension and stress relief and energy boost that comes from physical activity, as well as the mental relief of having the energy release of regular physical activity, endorphins that reduce the feelings of stress, tension, panic. And we also see large benefits, significant benefits for those who practice mindful movement. So mindfulness-based stress relief is something that we're going to talk about a little bit when it comes to PTSD and trauma. It is a way of being very mindful, paying attention to the body, noticing sensations of feet hitting the ground, or the rhythm of your breathing, or the feeling of the wind on your skin as you're participating in physical activity. Mindful movement is something that has been evidence-based for grounding patients who tend to get stuck in their heads or in the universe instead of grounded into the present moment in their body. And oftentimes with patients who are very, very highly anxious, patients who have panic attacks, they can't tell you where their mind is. And so helping them to make that connection with their body, appreciate what their body is doing, how it's moving, how it's feeling, is a huge benefit and can definitely show big, significant improvements in patients with anxiety and panic. So as we benefit physically, we also benefit mentally and emotionally by learning to interrupt the flow of constant worries running through our heads and grounding into our bodies in the moment. So let's move on to physical activity and stress burnout. There's a lot of great research in this area right now. We know that for patients who, or for individuals who have a lot of stress in their lives and just can't find the time or can't make the time to increase their activity, we see an increased level of depression as well as a decreased level of physical activity. So increasing sedentary behavior for these individuals. And this is contrary to what we know is helpful for people who have stress and are experiencing burnout. So there's a lot of great research in terms of a multimodal treatment approach. Multimodal treatment just means many modes of treatments or many methods of treatments that are being combined to a combined treatment approach to help the patient see the greatest benefit in the shortest amount of time. So there was a study that consisted of about 69 patients, 65% of which were women, who were referred to a stress clinic due to stress-related exhaustion. And all of the patients received multimodal treatment with a major goal of increasing patients' physical activity level. And the key point here is that the patients received general comprehensive instructions, including personal advice regarding the positive effects of physical activity on mental health. And they could also self-select for an 18-week coached exercise program. So you'll probably recall, if we go back to the slide on the physical activity correlates, the social support. One of the things I forgot to mention was the social barriers, not having anyone with whom to exercise and not receiving encouragement to exercise, as well as competing demands in the role of as a caregiver are significantly correlated with reductions in physical activity level. So if we think about this particular study, they really combined the social aspect as well as the advice and encouragement. So that positive affirmation of having physical activity and maintaining that level of involvement for a long period of time. So what the study found was that folks who were mildly or mild to strong compliers did not differ from those who were non-compliant with physical activity recommendations at baseline, but after 18 months, there was substantial improvement in all groups, but mild and strong compliers reported significantly lower burnout and depression levels at the 18-month follow-up. So you're looking at a year and a half later, those who were even mildly compliant with the physical activity recommendations maintained significant stress and burnout reduction so much later. So that's a huge part of any scientific study is how long does the effect last? How long can we maintain that effect? So we know that for patients, particularly women who receive that coaching and support and that positive environment that helps enable them to continue, we want to make sure that we're giving patients the right recommendations and helping them to connect with the right kind of physical activity for them. So let's talk a little bit about attention deficit hyperactivity disorder. As we know, this is a disorder that has been increasing in many schools, and it is particularly, there's a disparate number of children and adolescents who are males and also who are ethnic minorities who are being diagnosed with ADHD in schools. Schools have decreased physical activity, and we're seeing an increase in symptoms of inattention, deficits in memory, low motivation, and difficulty persisting on tasks. So psychologists and psychiatrists have long been recommending modifications for physical activity for children and adolescents diagnosed with ADHD. However, many schools are not in compliance with this. And my son is one who has a physical activity recommendation on his 504 plan. Unfortunately, the school that he attends just doesn't follow that recommendation. They say it's too distracting to allow him to get up and take a walk when he's feeling very distracted or isn't having a easy time concentrating or following along with the teacher. So for kids, they have a difficult time now, more difficult certainly than I had when I was growing up in elementary and middle school. We had much more physical activity time scheduled in. So looking at what are the effects of physical activity for kiddos or even adults with ADHD, we know that regular physical activity can reduce the symptoms of ADHD, especially when the person remains consistent in getting physical activity each day over time. We know that physical activity improves the key symptoms in ADHD for individuals diagnosed or even just those who have the symptoms, including improvements in memory, concentration, mood, and motivation. So these are key elements. Motivation is a very difficult characteristic for individuals with ADHD because they receive so much negative feedback from the world and they have a hard time attending or persisting with a task if it appears or if it's perceived to be difficult or something that they have a hard time with. And so if you can encourage kids and adults with ADHD to persist, then they will find that their mood and motivation improves and that their memory and concentration will improve. We also know that physical activity immediately increases dopamine, norepinephrine, and serotonin, which improve focus and attention. And this mimics the effects of medications that are commonly used to treat attention deficit hyperactivity disorder, including Ritalin and Adderall. And so for many kids that I've seen who have very mild symptoms of ADHD, especially those who are female and have what we would call mild symptoms of inattention, physical activity can be a key recommendation in addition to some nutritional benefits that are seen from small dietary changes that I like to try first before we go the way of medication. Anytime we can get kids more active, we want to. So let's talk a little bit about physical activity and PTSD or trauma. As I mentioned before, mindfulness-based stress relief and another type of effective treatment called mindfulness-based cognitive therapy are two treatment styles that involve mindful movement. And so what we do is teach patients to sit and just notice what's going on in their body, as I mentioned before. And when you ground into your body like that, you start to notice how something that is in the in the going on in your head, it might be a memory, has a direct connection to a physical effect in your body. And what we can do is start to help patients learn that a trauma trigger is actually resulting in dissociation of mind and body. And what that means is a person may be sitting in the room with you, but maybe completely somewhere else in their mind. And so when we start to help patients learn to pay close attention to physical sensations in their body, we can help them ground back into their body, come back into the present moment, and overcome that stress response that immobilizes them. And that is very characteristic of post-traumatic stress. So movement involving cross-body motions and engagement of both the arms and the legs, including walking, running, swimming, weight training, and dancing, are excellent choices to recommend for individuals with PTSD and trauma. Outdoor activities also, as we know, getting outside is something, and we actually include this in mindful movement classes. If you can get outside and take a mindful walk, a mindful run, connect with your five senses. What do you see, hear? How does it smell? What do you taste? How does it feel to be outside? And how does it feel in your body to be outside? How does it sound when your foot crunches on the hiking path? So using outdoor activities, including hiking, sailing, mountain biking, rock climbing, whitewater rafting, and skiing, have also shown effectiveness in reducing the symptoms of trauma. So I have a very large proportion of my patient population who comes to me with a history of trauma. And one of the first things that I do is I assess the level of trauma that they've been through in their life prior to coming in to seeing me. And we immediately begin talking about ways through mindfulness-based stress relief and cognitive therapy and mindful movement to begin finding the connection between mind and body again. It's very healing, and physical activity is a key element of their treatment. However, I always invite a patient who's been traumatized to participate and never instruct a patient to participate. For those with a trauma history, it's contrary to effectiveness to tell a person what to do. So we always want to make the invitation and encourage folks to learn what works best for their body and what works for their mind, and to report back to us. All right, let's go ahead and move on to the mental and emotional benefits of physical activity. There are many, many mental and emotional benefits. Obviously, I've enumerated a few here. In terms of memory, we've talked a little bit about that. Endorphins improve concentration and mental sharpness and provide us with a greater ability to be on task and focused. And we've already mentioned as well that physical activity stimulates growth of new dendrites and dendritic branches. And that's that neuronal growth that we want to see. And it also prevents age-related decline. So in a lot of the older adult active communities, many of the activities directors are looking at ways to improve physical activity, although folks who tend to live in those communities tend to want to be active. And so my grandparents have lived in a 55 plus community for several years now and have remained very active into their 90s. My grandfather just passed away last year at 96, and he played his last tennis game at 95 and a half. So I certainly saw the sharpness of his memory in direct connection to his ability to stay physically active once he was no longer able to stay physically active. I definitely saw a decline memory-wise. Looking at self-esteem, sticking to a physical activity routine is an investment in yourself. And this is one of the most difficult characteristics of mothers, new mothers in particular, that I see in my patients. Just getting them to see that getting away, even for 10 to 15 minutes a day, is an investment in yourself so that you can care for others. And once you begin to see yourself as just as important as the other people that you care for in your life, you stop putting yourself last because you realize that you can't continue to pour from an empty bucket. So we work on investing in yourself, your mind, body, and soul, so that you can be your best for your children, for your spouse or partner, and fostering that self-worth, that sense of achievement, and improving mental, physical, and emotional strength. And that's really a different way of looking at it rather than just saying you should be exercising, because we know that it's for health reasons. When you look at it as an investment in yourself and your family, it sounds a little bit more doable, something that you have a little bit more motivation to try. Sleep is critical, especially for new moms, but really for children and adolescents as well. We know that ADHD symptoms can show up for children who are sleep deprived. We know that they do not perform as well at school when they are sleep deprived. So we want to look at how can we improve physical activity even in short bursts so that we can help regulate sleep patterns. Yoga or stretching can help promote relaxation and higher quality of sleep when it's done right before bedtime. And when we sleep better, we eat better. There are studies that show that for people who received less than 5 hours of sleep per day, they ate 569 calories more per day on days when they felt sleep deprived. We have less energy, and we also look for high fat, high sugar, high processed foods the following day. So physical activity can improve sleep, and having better sleep improves our nutrition, it improves our mental focus, our self-control, and it allows us to perceive the regular stressors in our life as less stressful and more manageable. So for those who are sleep deprived, we also look at small stressors as much more uncontrollable or much more annoying or stressful. So we want to look at that perception level, and we want to encourage folks to get better sleep or better quality of sleep by improving physical activity. Energy is something that we've been talking about all along. Regular sustained increases in heart rate throughout the week improve energy levels throughout the day and the week. And so for those who have low energy, we want to let them know that it probably feels like it's very difficult to get started, but that once they do get started, they'll notice a significant improvement in their energy level. And resilience. Regular physical activity improves healthy coping when faced with challenges. So, for anyone who's ever hiked a difficult mountain or has accomplished something very difficult, my son just started playing rugby, and for the first time, he participated in a tournament this week. He played 3 different games, and for one of the first times in his life, he actually said out loud, "I feel really proud of myself." So just being able to look at the way that we perceive challenges in our life, our immune system improvements, reducing the impact of stress, we know that getting regular physical activity can be a big part of all of that. Additionally, regular physical activity reduces the use of alcohol, drugs, and other negative coping behaviors. So when we have success and we've maintained achievements in physical activity, we are far less likely to turn to negative coping strategies because, first of all, the stress doesn't seem so stressful, it seems manageable. And second of all, we know that physical activity makes us feel better and helps us reduce stress. So we essentially are giving ourselves healthy outlets rather than having no outlets or negative outlets. So for folks who have mental health issues, especially depression and anxiety, these are some of the common barriers that I hear. And certainly I've said myself, I'm so exhausted. So when you're tired and stressed, it feels like there's no time. When would I even fit physical activity in? And so again, it's about reframing. Could you fit 5 minutes of a walk around the block? Many times when people go for 5 minutes, they think I could go around the block one more time. And so it's about just, making it short little bursts that are achievable rather than trying to get somebody to envision getting to the gym for 60 minutes plus the drive there and the drive home and, everything else in balance with what they also have going on in their lives. When folks are overwhelmed, the idea of adding gym time to everything that they're already doing seems undoable. So again, asking in all of the things that you're doing, how much time are you spending nurturing yourself? And how well do you feel enabled to continue to care for others if you are completely deprived? So helping them feel that part of their responsibility in their life can and should be prioritizing self-care so that they can continue to do the things in their life that are important to them. And that's really a way of connecting them with what their highest values are, and helping them connect with how can I continue to do those or have those things as priorities in my life if I'm spending so much time on everything else but these things. So fitting some physical activity in, in short bursts, maybe and we'll talk about this in a minute, just in their lunch break or in little parts or pieces of their day, can really help them feel that they're providing themselves with a little nurturance. It feels hopeless. And a lot of people have said that when they've tried physical activity and then gotten sick, or they've had a new baby, or their disability is a waxing, waning one, and they've become ill for a while, like with multiple sclerosis, and so beginning again seems really hopeless. But we also want to point out that everybody starts somewhere, and there's really, a lot of times we're judging ourselves, and we're putting a lot of harsh judgment on ourselves rather than connecting with the idea that everybody starts somewhere, and wherever it is that you start is fine. Slow is fine. A few minutes every day is a start. And so helping them feel proud of themselves for those few minutes when things seem pretty hopeless, helping them get started again. We talked a little bit about being my own worst critic. A lot of that judgment and criticism comes from inside. I've known highly obese individuals who don't want to be seen walking on the street or in a neighborhood or in a gym because they are so ashamed of their body shape. And so helping them connect with, how can you find a class or a coach? And again, it's that social capital, that effect of having the encouragement and the social accountability of getting them started and helping them persist, helps them gain small confidence that leads over time to greater confidence. And then for folks who are in constant pain, certainly we shouldn't ignore pain. Pain is a symbol that, or a signal that something is wrong. However, we also want to acknowledge that some pain can be more psychological than physical. And so we want to work closely with a healthcare provider that we trust, but also start with what we can do and do it when we can do it. Water activities can be helpful for those with joint or muscle discomfort, and group and coach-based activities can help individuals in chronic pain or who have chronic conditions that limit their ability to be active, learn to be safe and effective over time. So in terms of getting started when folks are depressed and anxious, general recommendations are to start small and set small, realistic goals that are achievable and help them build that initial confidence and motivation to persist. We want to encourage folks to be active when their energy is highest. So if they feel the most energy at 6 p.m., then we want to encourage them to take advantage of that higher point in energy to go for a walk, or to take the dogs out, or to do gardening then. Because if we're asking folks to get up at 5 o'clock in the morning and that's the time when they sleep the best, that's not going to be successful. Especially for depressed individuals, they're going to, try it once and then fail every day of the next following week. And that's just going to feel like a big defeat rather than getting them encouraged and motivated. So trying to find when they are feeling the best and taking advantage of when they feel the best to do a little activity can be very helpful. There is an iPhone app called 8Fit, and it is 8-minute activities. You can even find some that are 5-minute activities, or even just do 2 or 3 of the 8-minute activities. It's 2 or 3 minutes. And those I like to encourage for especially busy moms, new moms that don't, tell me they have no time or when would I do that. I have some moms who have 6 children, so when would I do that? And so I encourage them to put the app on their phone, and when they find they have a minute or 3 minutes just to, try to do some activity or turn on the radio or put on a record or a CD or their iPod and turn up the music that they really enjoy, dance with their kids, have a little dance party at the end of a movie when the upbeat music comes on, those kinds of things. And that leads me to the next point, which is to enjoy it. Any activity counts, and the more that folks enjoy activity, the more they will do it. And so we want to encourage them to find what works for them. With many bipolar individuals, I have heard often that dance is something that is highly enjoyable. And so I encourage them to find a class, or to, just have a upbeat playlist or a help me feel better playlist of songs that they really love, that really speak to their soul, and to put that on when they begin to feel low and dance around the house. Comfort, and again, this goes back to the patients with morbid obesity that have difficulty feeling comfortable in their own skin, much less in clothing. There's often a problem finding workout clothes that fit or that they feel comfortable in. Having a new pair of sneakers or finding some workout gear that is new and helps them feel comfortable is really important. So asking them about, do you have the gear? Do you have clothes? Do you have shoes that you can use to help you get started? And helping connect them to resources if they need help finding those. Rewards are important. Learning to associate non-food rewards are important. So, for achieving 3 out of 5 days of the week of physical activity, they might treat themselves to a movie, or having 3 out of 5 days of physical activity this week, they get to have a drive, through the mountains, or something that they would really enjoy. Maybe it's coffee out with a friend on a Sunday morning, or maybe it's they get to sleep in the next day. But whatever it is, it's important to ask the person what reward they would want, and and to have them write that down, so that they can see it and stay motivated. Put it in a place that's in sight, in mind, because if it's out of sight, it's out of mind. Finding a buddy for social accountability and motivation helps boost the mood, positive thinking, and again, it's that affirmation, validation support. So when folks are depressed, companionship has been shown to be as important as the activity itself. So we want to encourage depressed individuals to find a friend or to find a class or a coach that they can work with, because they get a lot out of that social contact in addition to the physical activity. And then again, like I mentioned before, finding ways to sneak activity into their day. So looking at, okay, well, housework counts. Taking care of the car counts. Taking care of your lawn or garden, you're walking, you're moving, you're up. Walking or biking instead of driving, taking the stairs instead of the elevator, parking further away, walking for 10 minutes during a work break, and making activity a family affair. So can we go for a family walk? Can we go for a family bike ride? We really like the ducks at the pond. We like to go see them. So instead of standing there and throwing bread to them, we're going to walk around this pond 5 times, and then we'll throw some bread to the birds. Things that we can do with small children as well. There are some great group fitness classes for new moms. Stroller Strides is one that I've had many patients participate in that's really helped them maintain a level of activity, reduce stress and tension, depression and anxiety in the postpartum period. And again, it's that social connectedness, that coach, the ability to do group fitness with friends, and then they all are able to meet at a park sometimes or go for coffee afterwards, so it's a double benefit. And then exploring things you've never tried before, going for a new hike, or, just finding new music to dance to, or taking a new class, or exploring a new park. And again, asking patients what works for you, what's something that you would enjoy. When Pokemon Go came out, my son and I went for longer walks than we had ever walked before. And so sometimes it's about engaging the kids to get out there and get physically active with you, and finding interesting ways to get the kids engaged. There are tons and tons of smartphone apps out there that help folks. Some kids really like to track their fitness. Map My Walk is another great, or Map My Run, another great app that is available for free, that helps people keep track and then share it on social media. So some people get a big benefit out of sharing their success with others on social media. So again, just finding ways to help them connect with what works for them. So that is the end of my presentation. It looks like I missed a subtitle there. I apologize about that, but I'm ready to take questions.
Thank you, Kara. This has been a popular webinar so far, as evidenced by the questions that have come in and also the number of people who are clamoring to get in to listen to it. So if you're listening to this on a recording later, know that we wanted to be able to have you in here while the webinar was live, and we hope that we are responding to some of the questions that you have as well. Kara, the first question is about, it's about the notion of pain and how physical activity prevents or maybe deals with chronic pain. And you mentioned this during your talk, but it also came out last week during a congressional briefing that I attended on the new physical activity guidelines. And the question really was centered around, is there a way to use physical activity as a type of intervention for the opioid epidemic? And I'm just wondering if you have any comments on that specifically.
Well, one of the things that I had mentioned earlier was the reduction in inflammation that happens when physical activity recommendations are followed. Inflammation definitely increases significantly the amount of pain that individuals face. And then there's also the level of mental attention and how much attention are we paying to the pain. Oftentimes with people with chronic pain, we find that they get very, very stuck on the experience of pain, and perseverating on that level of pain makes the pain feel worse. It makes it feel forever. It makes it feel more intense. It makes it feel sharper. And so in a lot of ways, the mindfulness-based stress relief or mindful movement approach is a significant benefit for those in chronic pain, in that it helps them distract the mind, and it allows them to pay attention to the pain without judging the pain. Oftentimes we judge it as horrific or impossible or detrimental or disabling. And so a lot of those words that go along with the experience of pain, while they may be true to some degree, it's probably not always that way. Most pain waxes and wanes. And so it's important for us to be able to use mindfulness-based stress relief and mindfulness meditations and mindful movement to learn to check in with our body, to be able to focus on other places in our body. So for example, I have chronic pain, I have degenerative disc disease and spina bifida and scoliosis. I also have an L5S1 joint injury from when I was in high school. So there are times when my pain is chronic, but sharper than others. And I have a difficult time with physical activity. And so during those times, I have learned through my own counseling training to look at the other places of my body, because my mind tends to want to go only to where the pain is. And instead of focusing on that place from the mental perspective, we learn through mindfulness movement and mindfulness-based stress relief to look at and pay attention to the other areas of our body that aren't in pain, and to help focus less on the area that is in pain so that we feel it less often. In terms of the opioid epidemic, as I mentioned before, when people are more physically active and they feel that they are, accomplishing their goals and remaining active, they have less reason to use opioids. They have less reason to use drugs, alcohol, particularly opioids. And so, between the mindfulness movement approach and the cognitive therapy approach of being able to overcome some of that negative broken record that's going on, and knowing that physical activity can be a highly effective stress and tension reducer in life, and that it only takes a few minutes a day to achieve that, we know that we can accomplish reducing what leads to use of opioids, including inflammation in the body, as well as, and inflammation also increases depression and anxiety. So, there's no gate between the head and the body. We're certainly all one body, and we want to make sure patients understand that so that they can build those positive coping methods instead of resorting to medication for pain. That's where addiction is born.
Beautifully said. So I have a related question here, and it says, can mindful movement be incorporated into team sports or activities that require a lot of concentration or problem solving, or this is versus, does mindful movement work better with activities that are not as intellectually demanding? For example, walking, running, swimming, something individualistic, I guess. Do you have any
And
thoughts on that?
yeah, actually, it can be used effectively both ways. So, for example, I teach a mindful motherhood class, and so with a class full of moms and dads, I can teach a great mindful movement class where we check in with our bodies, and we go through movements together. And yes, they are gentle movements. They are stretching. They are yoga related and yoga based. But I also teach them to use the skills as they're going through their day. So mindful movement is also mindful washing of the dishes and mindful putting away dishes and mindful vacuuming. It's tuning into your body and your environment so that you are not completely disconnected. How many of us drive from our home to our workplace and then arrive at our workplace and can't remember driving at all? That is a mindless movement. And so what we want to do is just bring a greater degree of mindfulness to our day. So whether it's participating in a vigorous physical activity, exercise, or if it's participating in, gentle movements like yoga and stretching, whether you're in a group or whether you're participating as an individual, the mindfulness movement element can be used effectively in both.
Okay. And then a follow-up question, are there different benefits for mindfulness-based activities versus something intellectually challenging? Here I'm thinking of square dancing or something where you really have
Mhm.
to pay attention.
I think anything that we have to pay attention in doing is doing something mindfully. And so
Okay.
I can't speak to the specific research there, but my guess would be that the benefits would be very similar.
Okay. Is there evidence that's, okay, this one's about the rewards question. And, okay, I see. So the questioner is saying that sometimes with rewards, low impulse control might mean that it's difficult to put in a reward and not use it ahead of time or to wait for it, I guess, as
Mhm.
a technique. Any
Mhm.
comments on that?
I think it's about, knowing what the individual needs, and being able to schedule rewards so that it is rewarding enough to keep the motivation high. So for some people, they might need a motivation at the end of a workout, and others might be able to go a couple of days or be able to set a week-long goal. So I think it depends on the individual, and what their particular style of motivation and style and reward style should be. So I think again, when I work with a patient, I say, you know yourself best. So for you, would you be able to set a goal of 3 out of the 5 days this week if you achieve physical activity levels that you've, set as your goal? Then you give yourself a movie to go to with your husband, or, you allow yourself a more delicious savory dinner, or something that's I try to go for non-food rewards, but sometimes people go for the food rewards, and I'm not going to deny them that. um,
Mm-hmm.
but on the other hand, like I mentioned, if somebody says, I know myself well enough to know that unless I have a reward every single day, I'm not going to keep it up. And so
Mm.
then it's just a matter of looking at, okay, well, what about a really like lovely warm bath with lavender oils? Or, what about you go to the store and you get yourself some really delicious like body bath soap or something that you really enjoy using in the shower after you have a really hard workout? Or, looking at what if you buy yourself a pair of new workout shoes that you love? They look so cool. Or what if you buy yourself a couple of new, workout pairs of shorts that you just feel really comfortable in, or something like that that keeps them motivated? So it really is about, the reward is highly individual. And I
Mm-hmm.
think it's important to work with the other person we're talking with to make sure that it's tailored to their preference and need.
And that's reminding me that the apps that you mentioned, or most apps it is these days, come with their own, like, get a star for doing this much or reach a badge when you've done this
Absolutely.
many miles. So those are also built-in rewards too,
Yep.
and they don't cost as much. So there's that.
Right.
So I have a question that goes back to some of the data you presented at the beginning, and asking
Mhm.
about the race and ethnicity data. and whether it's U.S. data only, or is it just U.S. data that you were presenting, and is it independent of socioeconomic status?
So the data that I present, I looked at a couple of newer studies. The data, let me go back. Okay, so the data on race and ethnicity, let me just go back to my slide notes here. I can tell you that the SES data came from a Myers study. That was a US study. There is, yes, the other study that states that non-Hispanic whites are more active and less sedentary than other groups. That came from an NIH study, so that would have been a US study as well.
Okay. And a couple of people have asked about references, which I noticed were on the copy of your slides that we are posting on the website, and it's a good time to let folks know that, yes, that will be posted on the website as both slides and as a recording. So feel free to
Yes.
look for it later today.
Yes, I do have some reference on there.
Good. And I have a question here about if suggesting to talk to someone. Okay, let's see. This person's saying suggesting to talk to a person, maybe encouraging her to talk to the child's doctor about physical activity and how that relates to medications. The question is really, are physicians generally on board with physical activity as possible, I guess, co-treatments for medications, and kind of aware of how that might affect the amount?
I think it really depends on your physician. So I'll give you a couple of
That's what I
examples.
would have thought too, yeah.
My husband was diagnosed with high cholesterol. His family has a long history of high cholesterol and heart disease. And the nurse practitioner that we were seeing at the time was part of an osteopathic practice. And so she wanted to put him on a statin, and he did not like the statin because he did not like the side effects of the medication. So he went back at his follow-up and said, I haven't been taking the medication and I don't want to take it anymore. I've changed my diet and I'm exercising vigorously for at least 30 minutes a day every day. And she told him that she would fire him as a patient if he did not follow the recommended statin medication that she wanted him to take. And he said, thank you. And we left the practice because he changed his lifestyle completely and brought his cholesterol back into range. And we're working with another doctor now, and he every 6 months he gets his levels checked, and he's doing great, just through nutrition and physical activity. But he did not have the support of that physician. So I would personally recommend that anybody who's knowledgeable about physical activity and gets guff from a doctor about including activity or making it one of the primary treatment methodologies should see another doctor. But I would also caution that a lot of doctors feel that way because maintaining physical activity is so difficult for patients. Maintaining lifestyle, change, starting and maintaining are very, very difficult. And often physicians do not view that as part of their job. That is not what they have been trained to do. They've been trained to prescribe medication and ask for adherence on medications. So just know that most physicians have received very little, if any, training specific to making physical activity or nutrition prescriptions. And many are very unhealthy themselves because of the lifestyle of medicine. It's not very conducive to being a healthy individual. It's hard to do. And so, some physicians have greater faith and greater knowledge in this area than others.
Yeah, so and you could say that about a number of issues that relate to lifestyle health promotion or personal health promotion when talking about it with physicians too. I want to take the last couple of minutes we have, Kara, just to mention that a week ago the U.S. released new physical activity guidelines that were very much similar to the ones that we all had known about for the last 10 years. But there was one major thing that I think fits in really well with what you just talked about during your presentation. And that's that in the 2008 physical activity guidelines, there was an emphasis on doing exercise in at least 10-minute bouts. And as of last week, that need for exercising for at least 10 minutes has been completely eliminated. So the encouragement that you're saying to do, a 4-minute dancing to a video on YouTube or on the radio, listening to music, taking the walk around the block for 5 minutes, all of that adds up. And they have more research over the last 10 years that shows that you don't have to do it in some sort of a, set amount of time.
Mm-hmm.
So for those who have been worried about time in particular, and this came up in some of the questions as well, I'd like to just let everyone know, if you haven't already had a chance to look at that that's one of the key changes that came out during the new physical activity guidelines that were released this month. And also there is a campaign that went with that called Move Your Way that's available over at health.gov, where people can help to kind of plan when they're going to get physical activity in. So I think that's critical to let folks know as well.
Mm-hmm.
Do you have any closing comments? I do have a couple of more questions here that I'm going to try to take offline and see if we can respond to folks afterwards. But we are at the top of the hour, and so I wanted to give you a chance to close out. Any closing words?
Thank you. I just want to thank you for letting me come and talk to you all today, and hopefully I've given you some information you can use. I'm happy to follow up by email if you'd like to share my email with folks. Happy to answer questions offline.
Fabulous. Well, thank you, Kara. This has been a wonderful presentation. I think it's been a long time that we've been hoping to have someone to talk about these issues, and I really appreciate you sharing your time with us today.
No problem. Thanks again for having me, Pam.
All right. This ends the NPAS webinar for today. Goodbye.